Hey guys, good morning. This is Gabe Roberts from Back to Nature Lifestyle Medicine. I'm just going to give a little bit of some advice based on some events from this last week. I've had a number of patients come in this last week, and the first thing they tell me is that their medical doctor or their internist has told them to really reduce the number of fats in their diet. And this is really poor advice. The fat era that was the fearful fat era, I should rather say, that began in the 80s was actually largely influenced by the sugar industry. And what happened whenever we got rid of a lot of our fat in our diet, we started getting low fat, no fat, zero cholesterol foods. What this has actually done is driven up 100 million diabetics in our population. Whenever you're not eating fat, your liver and your heart are actually starving, okay? And diabetes type 2 is largely influenced by the liver function. You improve the liver function of diabetes type 2, and you're gonna significantly improve sugar handling problems. And the liver needs fat, it runs on fat. Our brain is about 75% saturated fat by weight. So I'm just going to tell you, when these medical doctors, internists, when they give you advice about eating low fat or no fat, they're actually acting way outside of their scope of practice. They are not trained in nutrition whatsoever, and therefore they don't deem it a necessary protocol. They don't see that, you know, what you eat really matters, when actually it does matter. So liver, gallbladder, those things need fat. And if you don't have fat in your diet, your cells just don't function correctly. We have vitamin A, D, E, K, and F that are all fat soluble, and those are necessities for proper cell function. You eat a low fat diet, you're gonna have problems. You have your gallbladder removed, you're gonna be deficient in those fat soluble vitamins. And I hear it time and time again. I heard a patient this last week tell me that their doctor said the gallbladder is useless. Okay, I don't buy it. I can't believe the things people have fallen for. Your gallbladder's there for a reason. It helps to digest and emulsify fat. And every person that has their gallbladder removed, every one of them are going to be deficient in vitamins A, D, E, K, and F. Okay? Watch what happens to your eyes. Watch what happens to your cell function. What happens to your signaling. When you are deficient in these vitamins, you're going to be in a world of hurt. And as well as the average person I see that had their gallbladder removed gains 40 pounds after it's removed, because now they have a constant flow of bile into their colon. And bile is only supposed to be there when you eat fat. Now it's a constant supply. So I just want to tell you that don't listen to poor advice, okay? Don't listen to people acting outside their scope. People don't come to me to talk about blood pressure medications or metformin or all this other stuff. I don't know anything about that. My scope is nutritional basis. My scope is not medications. So if you're getting nutritional advice from MDs, they're acting outside their scope. They don't know what they're talking about. So just keep that in mind, all right? There's going to be a lot of a confusion out there. I mean, we live in an era of spin today, and people are just so confused. They don't know what to do to take care of themselves. So I'll just kind of leave you with that. Today, I want you to love yourself, love each other, and make it the best day you can for yourself. Thanks.